So welcome and thank you all for joining the Resilience in Transportation webinar series, Lessons from Africa's Response to COVID-19. In this series, we explore how transportation agencies and governments around the world are responding to the global public health crisis to address mobility challenges and invite experts to share lessons learned so far and thoughts on how future resilience planning will be affected. The series is co-hosted by NUMO, the New Urban Mobility Alliance, GIZ, TUMI, EUROCLIMA Plus, and the World Resources Institute Ross Center for Sustainable Cities. Today, we'll hear from Janene Tuniz of United Nations Environment Program's Share the Road initiative about results and insights from a survey of African local leaders on how they are responding to mobility needs during COVID-19. Emmanuel John will share how Nigeria is working to accelerate the development of sustainable urban mobility to catalyze recovery from the pandemic. Finally, Mr. John Paul Munyandamutsa, Director General of Social and Good Governance for the City of Kigali, will present on efforts the city has undertaken in response to transportation challenges created by COVID-19. If you'd like to test your knowledge on this webinar and build more expertise on sustainable mobility, try out the TUMI quiz by visiting the link in the chat box. As a note, we will be doing a question and answer session at the end of the presentations, but feel free to submit your questions via the Q&A feature here on the GoToWebinar platform. Thanks again for joining us, and we're going to start today with Janine. Janene Tuniz is a project coordinator for the UN Environment's Share the Road program based in Nairobi, Kenya. The program, which forms part of the Sustainable Mobility Unit, aims to create benefits for the environment, road safety, and accessibility by working with governments and other stakeholders to prioritize investment in infrastructure for people that walk and cycle. Her current work is focused on sub-Saharan Africa and involves researching and prioritizing the needs of vulnerable groups and engaging with stakeholders to adopt and/or implement low greenhouse gas and sustainable transport strategies. So with that, I will turn it over to Janine.
Firstly, I just want to say thank you for having me. I'm grateful to be part of this session and to be sharing some of the information from the research that we've been doing in collaboration with the Walk 21 Foundation and some excellent researchers from the University of Manchester. I want to begin by really highlighting that the pandemic has affected countries and regions in Africa very differently. There's been an incredibly diverse range of dose and measures to mitigate the virus transmission, including quarantine, isolation, curfews, lockdowns, and alcohol and cigarette sale prohibitions. And the response to managing transport specifically has been equally diverse, due in part to the fact that each country has its own unique mobility ecosystem. And these systems each have distinct elements of informality that are difficult to map, let alone regulate. That being said, the African Union, together with the African Centers for Disease Control and Prevention, did in May of this year issue a COVID-19 guidance for the transport sector. It's a short document that uses the different outbreak phases defined in the Africa CDC stepwise response, which is a wider guidance document to make recommendations for what they call community physical distancing. Now, we as Share the Road are particularly interested in this component. Consider alternate transportation that allows for appropriate social distancing measures to be maintained. So, for example, walking or riding a bicycle. Of course, we sought to understand the wider mobility landscape, but we really tried to hone in on this element since walking and cycling, or non-motorized transport, as it's often referred to in the African context, is often not prioritized or even in some cases thought of. So we've all seen the headlines around the world as a consequence of COVID-19. Cities are turning their streets over to walkers and cyclists. Although I'm reluctant to speak about something that's been so devastating for so many in an optimistic or opportunistic way, it's really been framed as the moment for mobility on a more human scale. But I know, for example, in Nairobi, where at the moment there are more than 40,000 reported cases, initially this narrative didn't seem so prominent. We're seeing more of a buzz around pedestrian and cycling infrastructure in the city now, which I'll get to a bit later, but initially very little was known about what was happening in Nairobi and in other cities across Africa. Also, I think it's important to note that in most cities, like Addis Ababa, for instance, there's a very high percentage of people that rely on non-motorized transport. It's 54% in Addis, 65% in Accra, the capital of Ghana, and in Lusaka, Zambia, it's also around 65%. So we put together this survey. The survey was a collaboration between the Walk 21 Foundation and the UN Environment Share the Road program. We wanted to do three main things: showcase good practice of mobility responses to COVID-19 in Africa, collate an evidence base for future collaboration and action, and ensure that any support offered by potential international collaborators match the needs identified by people working in the sector in these African countries. Also, we wanted to figure out what was happening. For example, will the increased demand for safe walking and cycling and access to public transport change the perception of value for these modes in policy and decision making? And will this period instigate new sustainable transport policies and accelerate the delivery of more supported infrastructure in the region? We compiled the survey and had it reviewed by a collection of organizations, including the University of Cape Town, the FIA Foundation, and the Global Alliance for NGOs for Road Safety. Then, as a first step, we shared the survey with UNEP's high-level sustainable mobility contact database, and thereafter disseminated on social media in the wider networks. We were unable to get a response from every African country, so these responses apply to 30 countries. Most of the respondents reported that their region was in the early and expanding phase of transmission or advancing and large outbreak phase in the time that we took this survey, which was August, September. And these are terms that are defined in the Africa CDC document for the phases of outbreak. From the graph, you can see that most of the responses were from East Africa, with less responses from North and Central Africa. Most of them were from national governments, and most respondents, unsurprisingly, worked in the transport sector. So because the number of respondents was quite small, and because we wanted to verify the findings, we turned to a number of different data collection projects to get a better overview of the context. This map, for example, is adopted from the Oxford COVID-19 Government Response Tracker and the Google Mobility Reports. Broadly, it shows the relationship between public transport closure policies and changes in public transport use. So, for example, South Africa. There was recommended closing or reduced volume of public transport. You can see it's in dark blue there. But we can see that then there was a 36% decrease in visits to public transport hubs. In Gabon, the same measures, you can see it's also dark blue, were implemented, but that resulted in a 16% increase in visits to public transport hubs. Mali and Namibia, on the other hand, at the time the data was collected, both didn't have any measures in place, but there was a 25% decrease in movement in Mali and a 48% decrease in Namibia. Now, the reasons for this are still unclear. Maybe it has something to do with the fact that for some people, staying home is simply not an option. Also, it should be noted that not everyone who's using public transport carries a mobile phone, nor does this data account for the informality for some of the transport systems. So it needs to be understood with a little bit of a critical lens. For sure, more research is necessary to find out how people moved and how it impacted their mobility. And in fact, we do have another survey and some more projects in the pipeline, so we'll keep you in the loop on that. But from our survey, we were able to pull out some interventions for walking and cycling specifically. There were multiple reports that there was an increase in campaigns to encourage walking and cycling. In some instances, new footpaths were built, and we had reports of bicycles being provided for essential workers. I know in Uganda, for example, the president said that it was healthier to use a bicycle than public transport. And shortly after, the Turkish government donated 100 bicycles to Uganda's COVID-19 National Task Force. What was quite surprising, with all the momentum and the hype for walking and cycling, was that less than 20% of the survey respondents reported any actions to make walking and cycling safer during COVID-19. This is the case even though modal share for walking is more than 70% for all trips in most African countries, showing a bit of an imbalance between the need and support. We also found that those with existing data, capacity, and policy were more likely to act. What was encouraging, though, was that 94% of the respondents were willing to do more to support walkers and cyclists in future. the survey responses highlighted 3 key barriers preventing the implementation of walking and cycling projects now. The first was money and a lack of resources, with investments likely to be targeted towards other public health containment measures to mitigate the spread of COVID-19. Second, there's tentative evidence from the surveys that having high-level policy already in place is likely to support investments in walking and cycling interventions as quick wins that facilitate more rapid on-the-ground implementation. Thirdly, only a small minority of respondents reported that data had been collected on walking and cycling. Collecting data, and not only quantitative data, is critical to understand the positive and negative impacts of COVID-19 responses in any sphere. Overall, our findings indicated that most countries have not or do not intend to take COVID-19 related action to support increased walking and cycling patterns that emerged during the first few phases of COVID-19 restrictions. It's likely that some of the interventions from the survey were already planned or being implemented before COVID-19. However, the pandemic is likely to have acted as an accelerator to speed up these actions to support walking and cycling. Also, we have seen a lot of really inspiring and important innovations and events that have taken place in the months. So, for example, in Ethiopia, guided by the non-motorized transport strategy that was launched in June of this year, there's been an incredible amount of support for walking and cycling from the Minister of Transport. And she's emphasized the importance of these modes for ensuring healthy people and healthy cities. In Nairobi, the Nairobi Metropolitan Services initiated work on infrastructure in the Central Business District. And although very positive work, it's something that's been in the pipeline for a while and not necessarily a direct result of COVID-19. There are similar activities in Cape Town. According to our research, the city government is accelerating the rollout of the NNT master plan there as well. In Kampala, we've seen some really great advancements in these past few months. A pilot project in the city center has shown that active mobility projects in African cities can make a significant difference for pedestrians and cyclists because they create a safer environment for commuters during the pandemic and also long after. We've also seen an active civil society presence with issues related to COVID-19 and mobility. In the Ivory Coast, for example, I read just yesterday that they're now looking at planning the city's bicycle network, thanks to the continued active advocacy in the region. I could go on with several other examples, but I know that Mr. Munyandamutsa and Emmanuel have a wealth of information for you, so I'm just going to close with some recommendations that emerged from the survey and were developed with our wonderful friends at the Walk 21 Foundation. Overall, there's definitely room for a post-COVID-19 Africa vision for mobility that is healthy, safe, equitable, and sustainable. We need to build back better. There's a key need to prioritize informal settlements and low-income communities with essential, equitable basic infrastructure like continued footpaths and safe crossings. Then we need to do something with this new enthusiasm. Those with political commitment, qualitative and quantitative data, and design guidance need to act now and take advantage of new funding streams and momentum. And then we need to lean on each other. We're working on developing a network for walking and cycling made up of academics, NGOs, and governments, and we need to join forces to learn from one another and use our experiences to ensure that we don't make the same mistakes and that we can fast track things that work. That's it from my side. Thank you.
Thank you, Janine. Next, we will hear from Emmanuel John. Emmanuel is a sustainable transport expert and Director of Administration and Strategy of Transportation Growth Initiative. Prior to this, he's been working with the government of Nigeria at the Federal Road Safety Corps for 20 years as a transport and road safety expert. Emmanuel currently coordinates many sustainable urban mobility initiatives in Nigeria and in Africa, including the annual Africa Sustainable Urban Mobility Course and the Open Streets Initiative in Nigeria. Emmanuel leads different groups, both in advocacy, research, and expert guides to government on COVID-19 and the transport implications, with 3 published articles to his credit and a latest publication titled COVID-19 and the Transportation Implications in Abuja. A call for accelerated development of sustainable urban mobility in the post-pandemic recovery agenda, which recommendations is currently receiving attention at the highest level of government in Nigeria. And with that, I will turn it over to you, Emmanuel John. Thank you for joining us.
Thank you very much, Lynn. I'm glad to join you. Pardon my coming a little bit late behind, owing to some movements that took place this morning. Okay, so Transportation Growth Initiative is a professional organization that cuts across government agencies, academic, civil society, and other professionals with its corporate headquarters in Abuja. And we deals on research, advocacy, stakeholders, cooperation, human capacity development. So we are involved in a whole lot of conferences, stakeholders engagement, training programs, and the rest of it. COVID-19 came as a huge shock to the entire world. And in the course of making different presentations, I found this, somebody captured this statement from me and sent it back to me as remarkable. So I have put it as my slide beginning. By way of introduction, we had our first COVID-19 case on the 27th of February 2019. And then a few additional cases that came from outside to Nigeria within February, last week of February. But as at 13th of October, we have 60,600 cases with over 1,000 deaths. Of course, comparatively, this is very small compared to cities of Europe, countries of Europe and America. But it's our belief that the limited attention to the transport component of the measures may have contributed to the increase in the rate of spread of this virus across our countries, across our cities. Now, Nigeria has a population of 204 million people. 48% of that figure, of course, owing to COVID-19, I've been told recently that the figure has increased to 52% of that population lives below the poverty line. About 100 million working population, with 80% of that population earning income on daily basis. They are in the informal sector. What they make today determines what they eat today. And so if they don't go out today, they don't eat today. So in the responses to the COVID-19, economies were shut down, movements were restricted, markets, shops, schools were closed with attendant consequences across. Now look at the photo by the right. You will, that lady, that young girl you see is selling water, packaged water in leathers. The entire family is likely relying on what she sells for the day, for the family to feed. And for that reason, any disruption that prevents her from going out for a day puts the entire family in hunger for that day. And there are thousands and millions of people who live just this way, earning income day by day. But more importantly, in the course of the lockdown, which was one of the measures taken where everybody were asked to sit at home, supply chain was truncated. Foods could not get to the market because the transport restrictions did not leave exemptions. Even though they said if you are carrying food and you are carrying drug, you are permitted to pass, security agencies never enabled transporters to effectively do that. And for that reason, there was truncation of supply chain. And so by the third, fourth week into the lockdown, food became scarce, prices went up, price of drugs and essential commodities in the market went up. And up to today, never came down, even after the lockdown has been eased. Essential workers, majority couldn't go to work. If you do not have a car, you cannot go to work because the public transport was totally shut down. And for that reason, there was somewhat impact of that on service quality generally across the value chain, from hospitals to other medicals, including police, the security agencies, the waste management, disposal, and all of that were affected. Also, in April, a statistics from the National Bureau of Statistics Nigeria says 4 out of 10 jobs were lost, with a projection that 39 million jobs will be lost by the end of 2020. Also, 700 reported cases of sexual violence in the month of April, nationally by the police. But a city that has a sexual referral center reported 299 cases in the same month. And that is just 1 out of 16 other sexual related referral cases across the nation. So the tendencies are that the result from the police is quite too small compared to the implications of the sit-at-home order. Experts believe the resultant hunger, depression, and other mental health problems had more negative impact on citizens even than the pandemic itself. Now, so the question was this lockdown necessary? The answer may be yes, but maybe it is no. Why? Because there are no indices. All of the statistics from the National Center for Disease Control did not show any difference of confirmed cases that is sufficient enough to have justified the lockdown. Prohibition of, so measures were published by different cities, including Abuja, Lagos, Port Harcourt, and other cities across Nigeria. And all of these measures includes prohibition of commercial motorcycles, tricycles meant to carry 3 persons instead of the 4 or 5 persons they carry. Small sedan car that carries 6 people, 2 persons behind, another 2 on 1 seat in front, with the driver making 7, were all dashed to now carry only half or whatever they were carrying before. Buses were reduced to 50% installed capacity. All bus stops, motor parks are to maintain environmental hygiene, and officials of the parks and bus stations were expected to provide temperature checks for everyone that uses public transport, and wearing of face covering was mandatory. But these were different measures. We'll look at it whether there were compliances, of course, in the few slides before I round up. Yes, the BRT in Lagos operated at 60% capacity, but then the BRT conveys only 1% of the 24 million trips. In Lagos, BRT takes only 1%, and that is far away from the needs of the population. So for others, the minibuses, the taxis, the measures were largely not obeyed. At the relax of the lockdown, there was upsurge of what we call commuters, as against other climes where the number of commuters reduced. This wasn't the case in our own scenario. There was a serious upsurge. People rushed because the vehicles were few, the social distancing issues were there. So because of those early days of the compliances, the vehicles were not sufficient. And so we had a lot of population upsurge trying to get into the vehicles. And this perhaps may have contributed to the spread of the virus. The first few days we saw, after the last lockdown, we saw some compliances, first 2-3 days. And thereafter, they were only complying when they see security agencies. So the vehicles can be overloaded, carrying 6-7 persons in a small sedan. And then when they see the police, they drop the passengers very quickly, cross to the other side, and pick up their passengers. Transport fare, of course, went up, and transport, we believe, contributed. So what exactly is the problem with our transport system? The kind of system we have, largely informal, majorly owned by individuals who owns either 1 or 2 cars or 1 or 2 buses, is difficult to effectively manage in situations as COVID-19. And so I did an analysis of an ideal system, public transport system, and the regular kind of public transport we have in Nigeria that includes a few high capacity buses, shared taxi dominates the space, staff buses of government agencies and corporate entities. And then in terms of ownership, it is multiple compared to an ideal situation. Government owns just a fragment, then transport unions and corporate offices own a few. Majority of the transport vehicles are owned by individuals. And all of that contributes to the nature of ineffectiveness that we saw all through the pandemic period up to date. Other informations are there for us to pick from. Terminals, unlike organized settings, majority of the terminals are just one or two there, and drivers are at liberty to pick anywhere along the road. And in the process of that, of course, exposures to, because you don't know who they are, the vehicles could not be ascertained to have been contaminated after the last trip as recommended by the provision of the measures, and all of that are the problem. So there is the need for us to recover green, which is our target. Different measures were published, which we shall see in the next two slides before I round up. And our target and our advocacy has focused on ensuring that we have green recovery in transportation totally in Nigeria. Before now, this is what we use as our transport development, where the car owns the road, and all development focuses on the demand side of transport, making the car the king of the road, and every other mode of transport only take peanuts in terms of development. And that has, of course, resulted to the kind of transport we have. Of course, our demand, again, is that we must shrink the car and give ownership of the city to the people, because that is the only way we can arrive at where we are going. And as a result of those focus on motorization, motorization have continued to increase as a result of the development pattern, which is focused on transport, on the car. And so informal transport, because people must move. If you can't buy a car, you find any other means you have to move. So if it is motorcycle, if it is tricycle, whatever means you can move, you move because you must move. And if you don't have a car, what do? That gives rise to the informal system that have consistently continued to grow in our city. Now, interventions came at different levels. Aviation there was too much emphasis and concentration on aviation. And some of us rose up and said, no, we can't continue to celebrate aviation as being the worst hit, because there are no sufficient statistics to justify that. And so we partnered with an organization to get out a study that 80 million of the population of Nigeria uses public transport. And day by day, the National Bureau of Statistics says 299 naira, which is less than $1, is the fare per trip in Nigeria. If you multiply that by 80 million, you have 16 billion losses per day, when aviation is losing only 24. So we were, disturbed that all interventions, every day you keep hearing about interventions to aviation, and there was none to road transport. So we put out knowledge, we put out reports, and that eventually led to the release of 10 billion naira, which was focused on organized public transport to assess in order to be able to recover from the losses suffered during the lockdown. And then another 75 billion survival fund, which is currently ongoing, and people can assess artisans, the mechanics, the vulcanizers, the drivers who don't have a company name, they don't have any business establishment, but are individuals in the transport sector, largely the informal people, are able to assess. And then government also announced the release and investment of 2,000 high capacity low carbon buses that will use LPG and LNG, that's low, what we call compressed natural gas instead of the PMS that pollutes the environment as part of their comprehensive strategy to reduce air pollution post-pandemic. Of course, it's also important to mention, as I attempt to begin to round up, that a recent study says 60% of low and middle income earners in Nigeria spends about 51% of their income on transportation. And so we believe that there is no palliative to citizens better than providing efficient, sustainable, safer, high capacity buses, cycling and walking as the mode of transport in our cities that people can access, that will reduce their cost of moving around in the city. So government also developed what is called the Economic Sustainability Plan post-COVID-19. And the emphasis was on housing and business sustainability. There was no transport as a component. One of the demands we placed to government and say, no, if you want to give people house, you want to make sure that people's business continue to survive, you must also think about how they get from their house to their business in a more sustainable way. And so that led to this report that we did. We're glad DFID published this report on their website only yesterday. High volume transport of the DFID, of course, published this report on their website only yesterday, and it's available at different levels for you to pick from there. So we talked about the gaps created by the pandemic in transportation, the previous urban mobility efforts and how they performed, climate change, transport, and COVID-19 issues, and some examples from sister African countries with 26 short, medium, and long-term recommendations. And the message is very simple: the city belongs to the people, and you can't continue to build for the car. In doing that, we've had the privilege of starting our sustainable urban mobility course, and then we do a lot of open streets in the city of Abuja. Thank you very much for having me.
Thank you very much, Emmanuel John. Next, we will hear from Mr. Jean-Paul Munyandamutsa. He is the Director General in charge of social and good governance for the city of Kigali. We're grateful to have you here today to join us, Mr. Munyandamutsa. I'd like to start by asking how mobility needs have changed during COVID-19 in Kigali.
To appreciate the good presentations I had from Nairobi and Lagos. It was really educative and very interesting. In Kigali, of course, we had 45 days of lockdown, which started on 17th of March. And this affected, of course, the mobility. As we were in the process of developing the resilience strategy for the city, the shock of COVID demonstrated how mobility affects the welfare of people, because we found ourselves in a situation whereby we had to feed 200,000 people from a population of 1.5 million that stay in the city. So it's a big percentage. We could not realize that such a situation could happen, but the government tried to afford the huge task because the necessity was there. That's what I can say. Yeah.
Can you speak a little bit about how the city government has worked to facilitate the movement of essential workers during COVID-19, specifically healthcare workers?
Yeah, there was special buses for them. Transportation for health workers was really easy because they deployed many vehicles to transport health workers, and we did not suffer from that side. Instead, pedestrians were allowed to go to markets And we are lucky to have markets closer to, close to where people stay. But the risk was that when there are many in the market, transmission would come from markets. And indeed, around May, we discovered that the markets were the higher ranking factor of contamination, and some tough measures were taken without closing the markets. And fortunately, it worked well. So far, we've lost only 30 people. And the total population of people who suffered COVID close to 5,000, because today 4,953 and 4,601 have already recovered.
Can you speak a little bit about how you're addressing the mobility needs of your most vulnerable people in your city?
We address the mobility through different mechanisms. The first one is we have a regulatory agency that fixes the price for transport. And though buses are owned by private people, but they can't afford to fix the price at a level that the vulnerable could not afford. Two, we chose to use bigger buses than smaller ones for facilitating people to benefit from public transport. They are taken in big numbers. Three, there is a plan to have lanes, specific lanes for buses, dedicated ones that run along existing roads, which I believe to save passengers time. And fourth, on all roads, we have pedestrians walkway for the pedestrians. And distances are not very long in the city of Kigali because it's not as huge as Lagos. So non-motorized transport is used by a big number of people.
Thank you. Are you undertaking any new interventions or pilot programs, or creating any new partnerships with civil society, academia, or the private sector to address the mobility challenges coming from COVID-19?
Yeah, because we have a plan to embark on use of BRTs, and there is a big program where PPP programs are seen as the way to develop transport. And since we regulate the prices with some incentives and subsidies from the government, we believe it helps people. Regarding the civil society, many intervention of civil society are in the area of social protection. So there are a number of citizens that get direct donations of money from government to help them graduate from poverty, or assist those who are vulnerable to access some facilities that are judged very basic. So more effort in empowering the vulnerable to graduate from poverty, but also infrastructure to give more opportunity in transportation. And when it serves majority of people, even the vulnerable are not left aside or left behind.
Thank you. So the last question I have for you today is, how is COVID-19 impacting long-term resiliency planning in Kigali?
It has affected a lot because SMEs have almost collapsed, and they were picking as the biggest employer, since we don't have the country is not yet industrialized enough. So SMEs were the biggest employer in the country. Another thing is that since people are not sending children to school, we are seeing a big problem of delinquency, which we did not experience before. And when the youth is vulnerabilized, it is a big factor in the planning of the future. But we are trying to address that by putting in place mechanism to bring back to school, and those who were affected by this period be rehabilitated, re-educated, and yeah, of course it affected also employment in a larger sense, because employers tend to believe short contracts are better than having a career contract. You see, because the shock has shown that career contracts are not in the favor of the employer. So all those factors are being analyzed and put in the framework of city resilience framework, and there are many engagements between government, civil society, and private sector to consider that shock as a lesson for planning in the future.
Thank you. Well, thank you very much for answering our questions. We're now going to move to the general Q&A for all of the panelists.
And there is another thing I would wish to mention.
Yes, please go ahead.
Yeah, we have a mechanism which is called Car-Free Day. Car-Free Day is a day where we walk and do spotting at the occasion, because cars are not allowed to circulate. And this has a very good impact, because some people could believe in the past that walking is a sign of poverty. And today, it is a sign of, I may say, higher civilization by taking care of our health, but also staying in the city with pride, cleaning it, because it is an environment where everyone exploit the nature rather than the infrastructure with roads and vehicles. So The car-free day is an event that takes place twice a month, the first and third Sunday of every month, and everyone walks, everyone rides on a bicycle, and it changes the mentality. So whenever there is opportunity to not use cars and buses, people take advantage of it, and it is something we could replicate in other cities as a good practice to change the mentality of mobility in cities, and this decomplexes those who cannot afford, because everyone uses the same ways. Thank you.
Thank you. Yes, that is a fantastic initiative. So thank you for sharing that with us. I'm going to move now to the questions from the audience. So our first question is for Emmanuel John from Jeff Turner at DFID HVT Transport Research Program. The question is, what role do or could the transport unions, such as NURTW, play in enforcing rules on operators or in organizing the informal operators in the recovery phase?
Thank you very much. We have 3 major national transport unions, the NURTW, which is the National Union of Road Transport Workers. We have the NATO, the National Union of Road Transport Owners, who are basically trucks and heavy-duty vehicles. And then we have the Road Transport Employers Association of Nigeria. So each of these are very big unions with membership across cities of Nigeria. They do not actually have vehicles of their own, as it were. Individuals who have private cars only belong to the union. And so the union have, of course, tried to see if they can implement whatever measures are published, but these are limited because to what extent they have control over the membership. And of course, they do not have the capacity to be everywhere to provide monitoring and evaluation to ensure that compliance is 100%. That is very difficult. So majorly, the implementation and enforcement of the measures is left for the police. And that has not worked to the best of our knowledge and in all of the statistics we have put together.
Thank you. The next question I'm going to ask is, I think for all of the panelists, so whoever would like to answer first, how can initiatives like the ones mentioned in Kigali and Abuja be further supported by African cycling and walking networks and international initiatives? What do change makers, bikers, and pedestrians need from outside? What can come from the city itself? So I'm not sure, Janine, would you like to take a stab at that one first?
Sure, I think I would say that this question really great advocacy for connecting government city planners to the people who are walking and cycling. So the moment that any type of plan is put into place or even conceptualized, there needs to be a process of engagement in which vulnerable groups are brought into the table. People who are using MMT or non-motorized transport facilities are brought into the conversation. I think as many people as you can get in the room or in the virtual room for this point in time to share what it is that they need from facilities, from infrastructure, it's super beneficial, and it can only have positive outcomes. So I would say the support that you can offer is advocating for this connection, making sure that there is an open dialogue between governments and people who are walking and cycling.
Emmanuel or Jean-Paul, would you like to also comment on that question?
Okay, thank you for the question. Yes, we have been engaged over time with open streets. Last year, we had a series of open street events in the city of Abuja. And we partnered with government agencies, including the city authority, who were part. We had the executive secretary came all the way to sign a commitment to NMT in the course of one of the open street events, and that was a great one. But going forward, one thing is key: they need to build collaboration across stakeholders. It's one of the, we have this situation where a lot of people want to do things their own way. Each person wants to stand his own and try to prove a point that he's doing well. So there is a need, researchers, advocates, government authorities coming together, building a robust collaboration. We started something like that in 2013, where we had what we call the National Bicycle Week. It held twice, and in the course of those programs, in one of the programs, we had bicycle rallies in 213 cities across Nigeria. It was such a huge success, and we had it twice, and then we couldn't get funding and sponsorship, and that was how that program ended. And we're trying to build collaboration. What is fundamental to ensuring that we sustain all of these issues are collaboration and support that is needed for us, because the enlightenment on NMT, on sustainable transport, is very low, and so it's difficult to convince government authorities to support financially. It's difficult to convince financial institutions or other NGOs in our client to support. So what you have is few individuals spending their last earnings to ensure that these activities hold. And once they cannot provide the money, the programs end. And that has been our concern in this part of the world.
Yeah, thank you. For us, if I take the example of Kafri Day, the city partnered with the Association of Gym Coaches, whereby the gym coaches sensitized their clients that sports outside doors is better than in a room, right? And we also collaborated with the Federation of Athletics of Rwanda, the Federation of Cycling of Rwanda, who brought even the stars in the exercise. Then cabinet ministers, even the president and first lady come regularly to participate in that event. And it attracts the interest of many people because it's an initiative that came from people who serve people. I mean, these coaches, local government organizations, and central government, stars in the community show up, and everyone thinks it's the fashion, and it makes a good impact.
Thank you. So we are just about at time, so I want to thank each of our panelists for joining us today. We really appreciate your time and your expertise. I also want to thank our co-hosts of the webinar series. The next webinar in the series will be hosted by GIZ TUMI on October 28th, and you can register for that webinar by following the link, which I've just pasted into the chat. So with that, we'll wrap up today's session. Thank you all for joining us, and we wish all of you good health. Thank you.